Good evening to you, Simon, and let's deal with the latest piece of breaking news, and that is that Bernie Sanders has dropped out of the nomination to be the Democrat candidate for the November election. So it'll be Joe Biden up against Donald Trump.
Yes, absolutely. The moment that Joe Biden can finally relax, knowing that he is going to be the Democratic Party's presidential candidate in this November's election. There's been relentless pressure, Sally, on Bernie Sanders over the last few weeks to drop out of the remaining primaries and caucuses because the Democratic Party's elite, which has very much coalesced around Joe Biden as the centrist, they want to be their candidate for November. They want to give him a clear path, in essence, to become the Democrats' national spokesman at a time of tremendous crisis here in the United States with coronavirus. And so Bernie Sanders has cleared the way for that to occur. He said in a televised message to supporters a short while ago that he could not in good conscience continue leading a campaign that he knew he could not ultimately win. But it is interesting to note that he's keeping his name on the ballot in those states that are still holding primaries and caucuses. He wants to carry on notching up delegates to the Democratic Party's convention, and that's because he wants to have a big voice at the convention. He wants influence over the party's manifesto. He obviously wants to try and move the party to the left. So he's very much indicating that he still intends to be a presence in this presidential campaign, even if he's not going to be a candidate.
So while we consider Joe Biden versus Donald Trump, of course, we're looking at the way Donald Trump is handling this crisis. For many countries, certainly here in South Africa, party politics is not really at play at the moment because everyone is working together to deal with this pandemic. But it seems that Donald Trump just can't help himself. What's he been up to?
Oh, I mean, he is absolutely putting himself in a defensive position so that he's ready to unleash a blame game between now and November. We saw it yesterday with that extraordinary attack on World Health Day, no less, an attack on the World Health Organization in which he actually accused the WHO of covering up coronavirus for months before disclosing its existence to the United States. There's absolutely no evidence whatsoever that the WHO did that. He took to Twitter, President Trump, a short while ago and said that as soon as the American economy reopens, and he's desperate, obviously, to get the American economy back to something approximating normal, he wants everybody to forget about coronavirus except for those people who have lost family members and friends in this pandemic. And that's a very clear indication that he is not going to welcome any kind of inquiry into his government's handling of this pandemic, given that there are all sorts of indications that back in January and in February there were advisers inside the White House warning the president of how perilous coronavirus would be to the US.
Well, while the politics continues, the United States had, I think, was it its worst death toll yesterday?
Well, New York City was notching up another record number. If we look at the latest numbers here, over 4,000 deaths now in New York City alone. Nationally, we're looking at 12,900 deaths across the United States. And the United States continues to lead the way. Within the last few minutes, more than 400,000 infections have been reported from coast to coast. The worry of public health officials here is that while the number of new infections in New York is slowing, and maybe New York State is just getting past its peak of coronavirus cases, there's all sorts of other hotspots to keep an eye on. New Orleans in Louisiana, Detroit in Michigan, Dallas in Texas, Los Angeles in California, and, as we know, a disproportionate impact on African-American communities across the country where larger rates of death are being notched up than in other communities.
Any scientific explanation for that, or could it just be that there are more African-Americans in the service industry? Very quickly.
Well, that certainly plays a role, but also African Americans, because of their economic situation, have a disproportionate number of underlying conditions: obesity, diabetes, hypertension, and so that turns this into an absolutely deadly and perilous situation for communities where some of those pre-existing conditions lend themselves to a greater degree of fatality from coronavirus than other patients might expect.
Well, thank you so much. That's our correspondent in Washington, Simon Marks, giving us all the latest news from the United States.